Call to order, then the pledge, and then you read the.
6:30 p.m. Board of Selectmen, Highway Commissioner, Cemetery Commissioner meeting. Prior to the pledge, I will read pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 38, Section 18. This meeting of the Dudley Board of Selectmen will be conducted in total or in part via remote participation. Specific information and general guidelines for the remote participation by members of the public and/or parties with a right and a requirement to attend this meeting can be found on the town's website at dudleyma.gov. For this meeting, members of the public who wish to watch the meeting may do so in the following manner: via Facebook Live and/or posted link at dudleyma.gov following the meeting. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. A roll call vote is required for all votes taken under this order. With that being said, everyone can please rise and face their nearest flag for the Pledge of Allegiance.
I pledge
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
under
under
God,
God, indivisible,
with
with
liberty
liberty
and
and
liberty and justice for all.
Thank you, everyone. Just going to go right into section 2 of the agenda. COVID-19 Public Health and Safety Briefing. First up, be Board of Health Agent Tom Purcell. Tom, good evening.
Good evening, Mr. Chairman. Good evening, members. Just some brief information that's going on. The governor just issued a new order today regarding supermarkets and occupancy loads. We're trying to find out what the occupancy load is for Park and Shop so that they can address any issues of overcrowding or failure to maintain social distancing. One of the things we did find was the 40% formula is much greater than what some of the stores really feel comfortable with. So, but it also states in the order that we're not allowed to downsize the numbers or modify the 40%. The stores themselves can try to maintain whatever they want, but the Board of Health or the locals cannot dictate anything less than the 40%. That's including customers and employees. Generally speaking, the people of the town of Dudley are really doing a pretty good job of social distancing. They're beginning to take this this disease very seriously, but this is not the time to let up our guard. We're going to be in for a rough patch for the next 3 to 4 weeks. Currently, we have reported in the town of Dudley 13 positive cases. We're one of the lower communities around. We have the lower, but things all of a sudden can turn bad really quick. All I can ask is that the good residents of the town of Dudley be patient. Be patient with the stay-at-home order and the social distancing, and be vigilant with hand washing and hygiene. And I encourage the residents to wear masks if you can, if you have them available. It isn't going to hurt to wear them. It may very well help. And the other thing is to check on your friends and your neighbors, see how they're making out with food, water, medication, and do a well-being check. Just remember, we're all in this together, and we're not here alone. So stay well.
A question for Tommy.
Yes, sir.
Tom, any issues down at the senior housing?
No, I've been in touch with Lucille once a week just to just to check in and make sure that, that things are okay. There's some general concerns. It's more of, they're not comfortable with the social distancing bit, but they're doing the best that they can. They're doing a pretty good job of it. Some people, what they do is they point out the non-compliance. So we check up on them, we remind people wherever we can. But relatively speaking, they're for that tight community, they're in pretty good shape. They are
Thank
paid.
you. Thanks, Steve.
Yep. That's all I have, Mr. Chairman.
Sorry, I was on mute. Next up would be Fire Chief, Emergency Management Director, Chief Kochanowski. Good evening, Chief. No.
Sorry, I was on mute. Good evening, everybody. Thanks, Mr. Chairman. So not a lot has changed over the last week for the fire department and emergency management. We continue to practice body substance isolation and the use of PPE in accordance with CDC and DPH. We have received a few deliveries of some PPE from MEMA. I have shared some of that with the police department. I spoke with Chief Wayner and texted with him a couple times. I'm still trying to get more for both departments, as well as water, sewer, and highway. I haven't got requests from the latter two, but Steve and I have been in contact quite a bit. Really, we just been running our calls, practicing the social distancing the best we can. If we have calls where people have symptoms, we're going as far as putting gowns on, masks, goggles. Most general calls that don't involve those symptoms, it's just a surgical mask, and sometimes goggles, sometimes no goggles, depending on the symptoms. We continue to take webinars on how to use the FEMA DHS website, and we're currently in the process of submitting all the receipts and overtime costs due to COVID. So I would still stress that the department heads submit any overtime costs and any bills that they can attach to the COVID-19 incident. One other thing I wanted to do real quick, I actually brought a pair of gloves to the meeting because myself and my work is seeing a lot of disturbing things with the general public and the use of gloves. I was driving home last night. I saw somebody driving in their car with their gloves on. We've seen people in the supermarket with gloves on, reaching into their pocketbook, reaching into their back pants. Gloves really aren't appropriate in that scope, because it's really all you're doing is spreading the germs worse, because you're getting things on the gloves, you're reaching into your pocketbook, you're picking up food. Every time you perform an action, you would have to take the gloves off. Like if you reached into your pocketbook, you should have to take the gloves off, reach into the pocketbook, and then put a new pair of gloves on. I am stating that hand washing and hand sanitizing more frequently is a much more effective way to prevent the spread of germs. So I have a pair of gloves here, and definitely don't get in your car because you just put all the germs from the gloves on your steering wheel. So I have a pair of gloves here. This is for everybody at home. I know somebody on TV probably did this before, but the way to take them off is you take one off like this, take the other one off like this and fold it inside of it, and then you throw it in the trash. Like I said, if you're performing an action in one area, such as washing doorknobs or cleaning the bathroom in your house, you can effectively use gloves. They're really not appropriate for a grocery store or a retail store. The other thing we're finding is that people are leaving them in parking lots, just disposing them next to their car and driving away. That's bad. Like I said, if you're performing an action in a small area, you can easily take them off and dispose of them. You're not helping anybody by wearing gloves everywhere, getting in your car, touching doorknobs, leaving them in parking lots, because all you're doing is spreading the virus worse. Again, I would just advocate for more hand washing and hand sanitizing. If you have the availability of hand sanitizer, I know it's hard to get right now, but if you have that availability, keep a bottle in your car, keep a bottle in your pocketbook, and use it more liberally. I've been trying to give hand sanitizer to the other departments. I've given some to the police department. So I would recommend that. And that's all I have.
Question for the chief. Dean, are you seeing any change either in terms of total number of calls or types of calls regarding the ambulances?
The call volumes actually decreased steeply. We're not going out as, we had a medium volume day yesterday, but we've gone multiple days with no calls. And while that hurts us in one avenue, it's actually helping us because people are listening to what I'm saying, obviously. Don't call the ambulance unless you have a life-threatening emergency, which is in guidance with what the governor put out, CDC and DPH, call your primary care physician and get the appropriate care that way. That's probably why it's dropped off. A second indicator of why it's probably dropped off, nobody's doing anything. Nobody's going anywhere. They're staying home. They're relaxing. So people with underlying conditions aren't exerting themselves. It could be a number of things. From a financial standpoint from the town, which I want to point out is absolutely secondary, but I'm just giving this report for the board. It was probably a good thing we had a big increase in the first part of the year in billing because we'll still finish far ahead of what our projections were. But I would expect over the last few months of the fiscal year that's going to drop off sharply. But we should be okay and we should be still ahead of our projections. So I hope that answers your question, Paul.
It does. Thank you, chief.
That's all I got, Mr. Chairman.
Okay, any other questions for Chief Kochanowski? Hearing none, we'll move on to section, I'm sorry. Who was that, John Massey? No? Okay, move on to section 3, Chief of Police, Steve Weiner.
Thank you, Mr. Chairman. Good evening, everyone. Basically, our folks are maintaining their patrol response and calls of service. We're still seeing consistent calls anyway, disturbances and a few other incidents. I think it's just more or less because the fact that some people are cooped up and so things are kind of limited in that portion as far as movement goes. But some things are down, but some things are fairly consistent. I gotta extend kudos out to the guys and everybody in the department for all they're doing. It's definitely a tough situation with everything that we're facing through this time. There's very little complaining out of everybody. They're doing their job in a professional manner despite all the challenges. So very proud of all the men and women working in the department. As you know, as Tom had just mentioned too, we're seeing a lot of changes from the state come down. And working with the fire chief and Tom and Mr. Reuter and everything, going through things, I think we're doing pretty well with everything that's happening there. Excuse me one second. But the issue is that some of these things, just like Mr. Purcell had mentioned just a little while ago, they come down in a press conference and we hear about it then and we have to try to scramble. Like one example is last week when the changes came to restaurants to be able to sell beer and wine on a carryout basis with takeout orders. That came down on a Friday afternoon around like 1 o'clock. So it was very difficult to get that information out to the businesses and then answer the questions on it. For example, one of the questions that we received was, what if a person has a delivery driver that's 18 years old? Can they deliver the beer for them? Well, I guess the short answer to that is yes, because they're 18 years old and the law exempts them. But these are just questions that are left unanswered. So A lot of those things that are coming through. That's a little bit of frustration from the state end as far as not getting advanced communication, which is causing some issues. But I think everybody's working very well together here on a local level to address all those problems as they come up. We're working to limit some of the activities in our local parks and playgrounds. So we've been in discussions about those things. We should probably be getting some signs up with those if they haven't already been put up in order to minimize that. More or less for passive recreation as opposed to any type of group activities or ball games or anything else of that nature. The courts remain closed and the staff is limited. So most of the business that's being handled, we're doing a lot of the business that would normally be handled during the day at the courthouse, restraining orders, harassment orders, evaluation questions, other things of that nature, any of the arraignments and things that are happening. So again, the courts have been kind of run by their own tune, and some of their messaging across the state has been very inconsistent as well. But our local clerk and the assistants have done very well working with us, so we really don't have a lot of problems from the local end as far as communication goes. One of the things I did last week was I worked with a judge from Woburn District Court that they're trying to spearhead an electronic restraining order and harassment order application. So I worked with them to help answer some of the questions that they had from the law enforcement end. Hopefully that's going to be out this week, so we'll have the opportunity to do these things remotely, to be able to email these things to victims and have them sent back to us, so we have to have limited contact with people from there. One thing we're looking at too is the sheriff's department is limiting any out-of-state travel. So we have actually a prisoner that's being held down in the state of Connecticut on a fugitive charge for rape of a 14-year-old. So we're actually planning on going to pick up that person probably by the end of next week sometime. So we'll have that person back in town at some point. I was also told this week that in the police academy end, Officer Pacheco's class has been suspended for reporting to duty there. So they're doing more or less remote learning, kind of similar to what we're doing now. And they're looking to resume sometime back in May when that all comes forward. Also, I think the fire chief had mentioned it, and I'll give kudos to him and everybody else for getting what we can get as far as protective equipment goes. But you're still seeing a trickle coming from NEMA. And I know Dean's been doing a lot and been rattling some cages there to try to get things. And things are just getting to us very slowly. So that also is a concern from that end. I had a local man volunteered, made some 3D masks, plastic masks for us. And it's one of these things too, as far as any type of community help and involvement. He's putting them together, and one of the things he needed was the banding that helps to strap it to your head. So they use waistband material. We were able to put it out on Facebook, and we had several people drop off spools of band for us that they were able to give to him. And he's steadily making some masks up for us, and hopefully we can get them to some of the other departments in town as well. So kudos to all them on that type of thing. It's just another great thing for community involvement. One other thing that we ran into this week, we had gotten a request from a woman who had she's a single mother, and she had recently got a job, had no transportation to get to the job. She was looking for a bicycle. We had none, so I turned her over to the Women's Club. Women's Club were able to help her out with that situation and get that taken care of. So it was another great opportunity for the community members stepping up and to help out others in this difficult time. And lastly, from our end, you probably saw it already, but we did the second installment of the story time for the students at Mason Road School, trying to keep them involved and active in some of the things as time goes on. So we posted that second video today, went out through the schools. Been pretty well received, and so we're hoping to continue these things as they go forward. But that's roughly what I have from my end, and I'll gladly answer any questions if anybody has them.
Question for the chief. Steve, are we still making periodic checks of the beach area?
We haven't done consistent checks of the beach, but that is part of our patrol, just because it really hasn't been open for the season. So we're going to go down and check again and see what the playground's being used or other things of that nature. So we will be stepping those up fairly soon.
Thank you, sir.
Any other questions for police?
Chief, Mr. Chairman, Chief, did we want to bring up about the sign making with the highway department for parks and recreation areas?
Yeah, we can. If what I had done was asked the highway department to make up some signs, so I sent out to Tom and Dean and John some sample language for postings. So as soon as we agree on what exactly the language should be, so I guess it's going to be the question from for the board's perspective. If you want nobody at the parks, or if it's only like passive, if somebody wants to walk or something else like that. I don't know if it's a complete no trespassing, or it could be. It's going to be totally up to the board. So I guess it depends how you feel about that type of presence, and we can gear the signs accordingly.
Any feelings from the board on that?
I'm comfortable leaving it to the discretion of the chief.
Jonathan, you good with that? Just work with all the chiefs and the highway and Tom?
Yeah, as long as, I think we're just gonna look for consistency with Tom
Right.
as to what makes sense. It's probably gonna be more of a social distancing message than you can't come in, because, I mean, as long as we maintain the social distancing guidelines, I think it's probably in the town's best interest to leave some sort of ability for people to get out of the house, but still maintain a suitable distance and be able to exercise and get fresh air. So but I defer to Tom on that.
You're on mute, Tom.
Yeah, I'm mute, Tom.
Yes, Mr. Chairman. What I'll do is I'll fall back on to keep encouraging the stay-at-home order and the social distancing. Is the chief and I, Chief Wayner and I spoke of passive people walking on walking trails and bike trails and stuff like that. That's one thing there would be what we call a passive enforcement. As long as they're not bunching up or ganging up, then it shouldn't be a problem. But basketball courts and football football fields, or playing football and all of that, that's kind of that defeats the purpose of the social distancing program. So those types of activities should be broken up. Groups of kids or groups of adults at night, parties, stuff like that. It's some of their social hangouts and all should be greatly discouraged. Again, the chief of police and the police officers, they have a way to be able to do things without having to get to the real strict enforcement of ticketing and arrests and all of that. They just encourage the social distancing and breaking up the groups. They usually do a pretty good job of that all the time. So all we're asking to do is just address that alone, and we'll be in pretty good shape.
Thanks, Tom. Anybody else? Hearing none. Excuse me, just get the agenda back up. So, motion by the board to accept the reports and take any other action. Entertain a motion.
So move, Mr. Chairman.
Mr. Massey,
Second.
second by Mr. Johnson. Any questions, concerns, or corrections? Hearing none, all in favor, state aye. Roll call aye.
John Marcy, aye.
Paul Joseph, aye.
Steve Johnson, aye.
Steve Sullivan, aye. All accepted. Thank you, everyone. Next up on the new business, section 1. Possible appointment of a special assistant public health nurse, Roberta Johnson.
Mr. Chairman, I'll run through my report really quickly, because I just want you to accept it and
Yeah, I'm sorry.
so we have three grants that you already know about. I'm not going to go over them. One's the CBDG grant, one's the Green Communities grant, and one's the ADA compliance grant. They require the board to sign it unless the board authorizes me to do so. I'm assuming without objection, you'll authorize me under the circumstances to do that. There's no changes to the grant. So I just want to make the board aware of it, that I'll be signing the applications on the board's behalf. We still are on track for applying for the Green Communities grant. effective May 1st. So I'm just trying to keep things moving. You know, the show must go on. So another grant program we're looking at real quickly is the SMART program that will marry onto our recycling program, whether it's the current model or a pay-as-you-throw model or whatever the hybrid the board might decide. There is some ability to get grants to offset the costs of several different recycling models, and I'm pursuing those and hope to have more information on that as that progresses. I did a quick call today to talk about where we stood with our salary survey. We're waiting for a few towns to respond to help us out with the salary audit, including Douglas, Sturbridge, and Oxford. Don Jacobs, our consultant, has some contacts. He's going to get in touch with for those towns, and we should be fairly on track with that. The summary is complete. The point rating system we reviewed today, and I think the board's actually going to like it. It's pretty well thought out. Our cybersecurity, I sent out a memo today. I don't know if the board had a chance to see it. Our cybersecurity consultant has been hired to complete work for those priority vulnerabilities that were identified in our report, our complete report, between now and June 30th. We agreed at a previous meeting that the board wanted to agree with me to get moving on getting those vulnerabilities taken care of. I think it's very important now based on the fact that we're doing so much remote work and access into our network. You know, now more than ever, we have to make sure it's secure. So that work is proceeding. I did want to give Michelle the opportunity just to touch base with the board about her outreach and resource efforts this week with the library. So, Mr. Chairman, if Michelle could just jump in here.
Yes, hi. Yeah, I had a conference call with Margaret Boussier from the Council on Aging, Drusilla and Lida from the library. Drusilla and Lida is the youth services librarian. And they've been reaching out to businesses, churches, and Tri-Valley. And it appears that right now Tri-Valley has all the drivers from Dudley. And the only ones that they really needed were a couple of days at the Slater Estates in Webster and Golden Heights. I'm really not sure if one of the girls from the Dudley Women's Club took that initiative and took that route. But as far as the churches, they're all doing virtual services. And St. Andrew Babola is having a blessing of the food, I believe Saturday. It's tradition. Drive up and they bless your Easter meal. And that's in Saturday afternoon. And they're all having their services, and they were all on their website. They have it posted on their website.
Thank you, Mish.
Any questions for Michelle?
I have a few things to add to that, Mr. Chairman.
Go ahead.
So I had a conference call to touch base with the core group with the schools when Charlton Board of Health agent, and we wanted to circle back from how we left things last week. They have decided on a vendor for the Dudley L cleaning and sanitizing. It's the same vendor that we're using for the town hall in a week from now. That was recommended by the fire chief. We've been using it for cruisers and ambulances, so forth. So they're well qualified and equipped to handle the job. So I'm very comfortable recommending that they move forward with that. They touched base with us on the school grab and go curbside meals program. They've served since this began. They've already turned out 15,000 meals to kids who otherwise would have had an issue getting a few square meals a day. So they continue with that successful program, and I think that's a real feat given the circumstances to continue to put 15,000 meals out the door in a few weeks. Of course, that includes both the Charlton and Dudley schools, but it's still a lot of meals to put out. If we run into a situation where there are some kids who are in our school systems, whether they're Dudley and Charlton, and I'm kind of talking through the board to Michelle as well, that we find qualify as students, and they'll feed them immediately. All we have to do is let the school know, and they can show up and fill out the application later. There's no issue with getting food for qualifying kids. And I reciprocated with the schools and said we had a mechanism to work on meals for other demographics that weren't necessarily students. So they're going to keep in contact with us. And then finally, I wanted to just have a quick conversation with the chiefs here on the line about the Families First Emergency Paid Sick Leave Act. I don't know if anybody on the board had a chance to look at it. I think I sent it out last week or earlier this week. Essentially what it is, in a nutshell, is it's an addition to the FMLA Act that allows 2 weeks of paid sick leave based on some specific criteria. It's specific to COVID-19. It's one criteria could be federal, state, or local quarantine or isolation order. Another criteria is healthcare provider quarantines the individual employee, or the employee is symptomatic, or another substantially similar condition. And there are 2 points that allow us to get an exemption, and I think this is really important. An exemption for emergency service workers. Two of the criteria here are caring for individuals subject to a quarantine from a federal, state, or local board, or a son or daughter caring just strictly for a son or daughter due to a school closing. So overall, we'd like to apply this. We don't have a lot of choice. We have to apply these criteria to our own employees. However, the order gives us the ability to exempt public safety employees based on some of the criteria. And I think that both chiefs are on board with the idea of signing the order, but providing that exemption for public safety emergency workers. And Mr. Chairman, maybe they can both speak to that to some degree. I don't want to overstep here, but I think my premise is that it's important that we don't universally apply this, because it wouldn't take much for someone to say that they need to go care for their son or daughter because they're simply not able to go to school. So they're basically out providing child care or care for any individual subject to a public health order, which may or may not be a family member. So either chief, if you could help me out here, I'd appreciate it.
I spoke to Jonathan about it, Mr. Chairman, and I read an email from Chief Wayner, and he can speak after I'm done. I agree with Chief Wayner. I think we should go along with what Mr. Ruda said. They're essential employees, and as far as if they get sick themselves, they're already covered under a different area, not related to that. And because I've already had 3 guys go out on quarantine for 3 days back in the beginning of this, and they weren't charged sick time, but it's going to be reimbursable through the FEMA grant. And I just think it's opening up a can of worms if we include them. I think it's better off that we just leave them out, as Town Administrator Ruda said.
Yeah, I'd agree also, Mr. Chairman. I think the big thing with this was we're all in agreement where we have employees that are impacted directly. We can work with them in whatever capacity we have to. But the language in this proposal was just a little bit broad. For example, if a daycare is closed and you can't care for your child, that they apply, they are eligible for the leave under this program. It's just a little too broad from that perspective. So it should be more directed to if there's something involving quarantine orders by a physician or also by the employer, one of the two. So that would be the main reason why I'd say we exempt the employees at this point.
All right, thank you. Any other questions?
Yeah, one for Jonathan. What is the name of the vendor that has been doing the cleaning for town hall and will be doing it for the schools?
I think it's Electric Clean. Is that right, Chief Kochanowski? Electric Clean?
Stand by, I'm gonna hold something up to the screen.
There you go. Maybe we should turn the video off.
Oh, it's all right.
Terry's the only one who gets me.
Can everybody see that? I don't know, I can't get the whole thing on.
Yeah, Electric Clean.
Yep.
And the reason they can't do it for Charlton schools is they're an employee of the town of Charlton, so it would have to go through a different process. But they're working on it.
So, question to you, Mr. Ruder, and to Tom. One of the discussions we had that was supposed to be a condition to the schools was this company, once they were hired, was going to go to at least Shepherd Hill and verify that they're using A, the proper equipment, B, the right chemical, and C, that they have the proper personal protection equipment. Is that still going to be part of the service that's offered?
If I may, Mr. Chairman, this is Tom Purcell. I guess the indication was instead of the Shepherd Hill staff being properly equipped and trained, there was a modification to the agreement to go third party, so that there would not be any question or challenge on the training or the inability to perform. With a professional staff, I think it would have satisfied all of the concerns, having the third party do it.
Okay, so they're gonna do Shepherd Hill in the middle school and Mason Road. Was that the new agreement, Tom?
That's in the agreement already.
Excellent. Excellent, because that was a big concern last week, coming out of that March 23rd meeting. And I know it was becoming a waiting game almost, if a certain amount of time went by, but I think it's an excellent choice by the schools. And if it took a little pressure and prodding from the town side, I think it was well worth it. Thank you, guys.
Thank you.
Any further questions for Chiefs, Mr. Ruda? I apologize, Jonathan, for jumping you before. So now we will go to new business. Possible appointment of Special Assistant Public Health Nurse, Roberta Johnson. Jay, can you give us a little background before we move, and we can have some questions if necessary?
Sure. So maybe I'll just bundle item 1 and 2 together, if that's all right, and then we can vote separately. I believe, Tom, that you told me that our public health nurse handles 12 other towns.
It's approximately, I'm not sure whether it's 12 or 11 towns, but indication is she has multiple towns, and with the rush that's on right now, it's very difficult getting the data that we need in timely fashion.
And just for an example, Mr. Chairman, on my conference call with the school today, it was identified to me that our public health nurse, Cheryl, received actually 59 more cases yesterday that she needs to handle. So when you talk about the term abundance of caution, I think that we have no other realistic, good faith option here, but to start taking a look at bringing on some additional help just in case we need to respond. I think we have a duty to do it and a responsibility to do it. And so I've spoken with the Oxford Town administrator, and she is bringing on 2 additional public health nurses. And through our discussions, we're looking at signing an IMA with Oxford to provide additional services if we need that kind of surge capacity. And I've also spoken with Roberta Johnson, who was on a member of our Board of Health and a school nurse, and she's also agreed to come on and provide services for Dudley specifically, and to work through that IMA if needed with Oxford. So I think that gives us an additional surge capacity if we need it to respond to, you know, the requirement to do contact tracing and to work through perhaps even clearing up some of these cases that may now be, you know, which Tom mentioned it earlier. Now, after you declare an address or a case at a certain household, now you have to track that case so that when the person is cured and is no longer needs to remain in quarantine and so forth, the next responsibility is to our own first responders to remove that household from the list. If for no other reason that they don't accidentally waste PPE and waste time getting there if they need to. Chief Kochanowski mentioned that PPE is running a little short, but we need the extra set of hands is the bottom line. So my recommendation to the board is to allow me to proceed with the IMA with Oxford, take advantage of the additional 2 nurses that they've hired, and to continue on with hiring Roberta Johnson to provide coverage here in town. And of course, Roberta would have to do things a little bit differently. First, as a member of the Board of Health, she would be answerable directly to the Board of Selectmen. And this has gone through our own town council to make sure that we're doing this the right way. She would also, if she made a recommendation to our own Board of Health, she would have to obviously abstain from the vote on her own recommendation. But those are 2 very minor adjustments that we would make. And she would continue to work with and for our health agent and our public health nurse, Cheryl, who is, of course, the lead on all of this, unless other arrangements were made. So I believe this is the right, prudent thing to do at this point.
Question? Jonathan, I'd like to suggest that there are 2 separate motions, and that the first one, which is about Roberta, if you look at the very end of your suggested motion, it says at the same rate of pay as the public health nurse. I would recommend that it would read at the same rate of pay as our current public health nurse. I think if we did that, it's very specific, not any public health nurse, but our current one. That's the only change I would make there. And then the second would be that we motion that we authorize you to enter into an IMA with Oxford for public health services.
Mr. Chairman,
Mr. Johnson,
I'd like to recuse myself from the conversation, and I'll be abstaining from any votes as it proceeds.
the record reflect, thank you, Jay. John Ruda, weren't these motions vetted and worded by council?
They were actually crafted by council. I don't have any objection as our current public health nurse. I can tell, just in the interest of full disclosure, it's about $80 an hour. But we pay as we use, as opposed to, it's not a salary position. If we need the help, we pay for it. And we have a mechanism of funding that's been coming to us through CMRPC. We're about $15,000 worth of funding just for that service. So we should be in pretty good shape. But I'm happy to, I don't have any immediate objection to Mr. Joseph saying our current public health nurse, because that's absolutely within a normal range of pay, rate of pay.
to Kerry and John Massey. As Jonathan Ruda said, this was presented by council. Does anybody have the objection to change the wording?
No, I think it's more specific. It states that it's our public health nurse and not the public health nurse.
John Massey, you good?
Yeah, that's fine. It gets the same job done.
Michelle Jarvis, you got those changes? We haven't made the motion yet, but you got the wording.
I do.
You good
Mr.
with that?
Chairman, before we vote, I just want to also mention that I spoke with Rich Carmignani, and we also have made arrangements to secure the correct insurance coverage, so there should be no issues on that end as well.
Okay. All right, so Chair will entertain a motion if somebody wants to read it, and then at the end, just change that last sentence to say same rate of pay as the current as our current public health nurse.
Mr. Chairman, I move that the board appoint Roberta Johnson as a temporary special assistant public health nurse under the direction of the Board of Selectmen in consultation with the health agent in order to provide additional support in response to the COVID-19 virus outbreak and the resulting local and statewide states of emergency to serve at the pleasure of the Board of Selectmen and whose appointment can be terminated at any time by the Board of Selectmen at the same rate of pay as our current public health nurse.
Motion made. Is there a second?
Second.
And seconded. Any further questions or concerns or changes? Hearing none. All in favor, state aye through roll call.
John Marcy, aye.
Paul Joseph, aye.
Kerry Siganovich, aye.
Stephen Sullivan, aye, unanimous.
One,
And one recusal.
recusal, yeah.
He actually recused himself so far his picture disappeared. Not necessarily odd. Not necessarily a bad thing for the rest of us, but what are you gonna do? Next up, section 2.
Just a 1 point. Even though Jay has recused himself, his vote should be recorded as abstention.
No, he wouldn't even participate in the vote. He recused himself from all discussion. I think we should leave it as a recusal. That's how we usually do it.
All right, okay.
John Ruda, is that more apropos? Because it wouldn't be an abstention because he wouldn't even be voting. It'd just be a straight out recusal as if he wasn't there.
He recused himself from discussion. All right, we have 5 members of the board here. There should be a record of the 5 votes.
Would you prefer if I abstain from the vote?
I think that your vote should be recorded as an abstention.
No. I'll defer to John Ruda as administrator. I just think if he's recused, wouldn't he be, in a perfect world, a recusal, he would leave the room like he did. He took himself out. He wouldn't even have a chance to say abstain.
I think the distinction with recusal, Mr. Chairman, is that you're not even in the room to, no, I'm not going to say intimidate, but to have any sort of effect on the vote that's being taken.
Right.
Versus an abstention, you're sitting here and abstaining, but I don't see any harm in doing both at this point.
All right, well then, just let the record reflect that not only did Mr. Johnson recuse himself, but his position would be an abstention from the official vote. Good with that? Thank you, everyone. Next up is the intermunicipal agreement with Oxford for Public Health Services. Jonathan, you touched on it. Do you want to, any questions for Jonathan, or do we just want to bring it to a vote?
A question to Jonathan, is there a need for Jay to abstain from this vote?
I would probably recommend that he did, because if Roberta actually had to participate and help Oxford out, it would, she'd derive income from it, so I would probably abstain from it as well.
Okay,
Let the record reflect that Mr. Johnson just recused himself again, and he will be abstaining from the vote.
Mr. Chairman,
Mr. Massey,
I move that the board votes to authorize the IMA with Oxford for public health nursing services or any other action relative thereto.
Second.
motion by Mr. Massey, second by Mr. Sigenovich. Any further questions, concerns, or comments? Hearing none, all in favor by roll call.
John Marcy, aye.
Gary Siganovich, aye.
Paul Joseph, aye.
Stephen Sullivan, aye. Unanimous. And again, I know it's a potential paid position, but I certainly speak on behalf of the board and the town when we thank Mrs. Johnson for her knowledge and her willingness to help at this time. Okay, Johnson, you can come back now if you can hear us. Oh, it's like the Wizard of Oz. Pay no attention to that man behind the curtain. Board member comments. Who would like to lead off?
I continue to be thoroughly impressed and grateful for the work that Jonathan, Dean, Steve, and all the other department heads are taking during this particular pandemic issue.
Thank you, Paul. John Massey, anything you want to add?
Mr. Joseph said it beautifully. I agree with everything you just said. Thank you.
Kerry?
I'd like to once again echo what Mr. Joseph said. I'd also like to thank the people who are showing up to grocery stores, people who are working there. They're working at the gas stations, delivering things to people. Things would look a lot differently if those folks weren't doing their jobs as well. So good job to everyone. That's all.
Johnson?
And that includes that kid, Tommy Purcell, too.
Yeah, it does.
It does.
Unfortunately, we haven't spoken much, Tom, but you're doing a heck of a job. Thank you very much.
Thank you.
Thanks, Tom.
Thank you.
Jay?
Thank you, Chief Wayner and Dean. Thank your guys for us. It's it's a tough time for both those teams for sure, and to the essential workers doing what's necessary in this tough time. Thank you all.
Right, I want to echo what everybody just said. It seems like we're saying the same thing week after week, but it's true. The professional staff we have has really stepped up. Jonathan, as a new administrator, has really steered the ship in the right direction. I can't say enough for Tom Purcell. We all know is not a full-time staff member with us, but he's putting in hours above and beyond what normally expected. The town keeps running smoothly. Treasurer Carmignani, who I didn't recognize earlier, I apologize, Rich. He's very good about getting
Thanks, Rich.
information out there. We get stuff from our insurance. He's sending out alerts and other things. So full-time staff is really keeping things moving in the right direction. And again, don't want to keep repeating ourselves, but as someone said early in the beginning, stay safe, check on your neighbors when possible. If you have elderly people in your neighborhood, try to stay on top of them. It's easy to pick up a phone away from the street. And hopefully we just buckle down, we'll get through this. So
Don't forget Albie.
Don't forget it, student representative, yeah, right.
I was gonna go to Rich Carmignani first as town treasurer if he had anything he wanted to add, and then Albie for anything for his Rich.
Muting there. Good evening. Not much. Things are going the same as they always do. Paychecks, accounts payable, like you said, the insurance, we're going to have our open enrollment coming up. Anybody who's on the town of Dudley insurance and they've got an issue, there is still the telehealth, the dial-a-nurse, that's available. If you don't have it, reach out to me or anybody in the treasurer collector's office, and we can make sure that we get that number off to you. Blue Cross has a lot of good things. Going to be a lot of wellness webinars and what have you. Renewals coming up, so 0 for dental, 0 for health. So thumbs up on that. Got to end on a positive note. So everyone stay safe. Have a happy Easter. And I got to wish my son happy 8th birthday. So
Oh, yeah, happy
Birthday,
birthday.
Richie.
All right.
Yeah.
Happy birthday. Thanks, Rich.
8 for Richie, 25 for Kevin tomorrow, my son, so.
Wow.
Go, Kevin.
Albie, you're up.
Hello, everyone. So about a day ago, 2 days ago, we entered phase 2 of remote learning for the school. Assignments are now mandatory. They are now mandatory. They were optional enrichment before then. They are now mandatory, so things are getting graded, and they're trying their best. All the teachers are working really hard and getting in touch with their students, staying on top of that. The third quarter is now extended through April 17th, which means we don't have April break anymore. So we're extending through April 17th. And then our fourth quarter details have not yet been released by Mr. Chaplin. We are still on the phone with him, trying to get through details. I'm not exactly sure if he knows what's going on with that yet. He's, talking with department heads, trying to coordinate things, grading, what have you. So we're just waiting from one email about fourth quarter stuff. And with senior activities right around the corner, our senior class is waiting on that as well. So I think if we go back to school May 4th, things will start to get better. And that will be a good thing. And I also want to just thank the department heads from the town of Dudley doing their job and really, really stepping up to the plate and doing their best. So that's all for me.
Excellent.
At the risk of getting everybody upset, Mr. Chairman, can I just do a follow-up with Albie?
Motion to adjourn. Oh, no, I'm sorry. What'd you
Just real quickly, the distance learning is at the high school level or all levels?
That's actually, I believe it's at all levels. So they're trying to get on top of things. I know Mr. Chaplin, I was in school council about 3 weeks ago, and he said, it's difficult with just the resources that we have to do online learning at full capacity, but through Zoom and Google Hangout and stuff like that, we're making it work across the board for the majority of the schools and all that. So, which is a good thing.
And how are they getting a hold of students to recruit them into the distance learning?
So each student has a district email through the school, and it's connected to the Google platform already. So what happens is, for example, for Google Hangout, I had one today with my AP Calc class. My teacher sent me a link, and we talked about the Calc live stream that we watched, and we talked about problems and AP exam, what have you. So that's pretty much what happens. They just send you a link, and they take it from there. So.
Excellent. Any further questions or concerns to the Dudley version of Hollywood Squares?
All set, Mr. Chairman.
Hearing none. At this point, the chair will gratefully entertain a motion to adjourn.
So moved.
Mr. Marcy,
Second.
multiple seconds. Any questions, concerns, objections? Hearing none. Roll call out of video session.
John Marcy, aye.
Paul Joseph, aye.
Carrie Siganovich, aye.
Jay Johnson, aye.
Stephen Sullivan, aye. Have a great night. Have a great Easter, everyone.
Go well and
Thank you,
be well,
Good
everybody.
night.
Bye.
Take care.
Bye-bye, everyone.